welcome to me Maharashtra News Channel. Well, today we are here at the most renowned hospital, which is Shushrusha Heart Care Center and Speciality Hospital. And we have the most prominent doctor of entire Navi Mumbai, Dr. SANJAY TARLEKAR with us. Let us have a chat with him and know more about the career, the beginning, as well as more about the disease of heart. Hello, sir.
Yeah.
So please tell our audience about the heart disease. Who are the people who are more, prone to heart diseases?
Okay. In short, I'll describe it. There are various kinds of heart diseases we have, but prominently the heart diseases which comes by congenital way. The diseases come from the by birth in the form of some congenital anomalies in the heart, where there is a loss of septum and there is defects of the septum, or there is a defect of the artery's origin. So all these things, these are called as congenital heart disease. They come with the by birth. Then there are some disease which comes along with the febrile illness, that is called as a rheumatic fever, that can leads to damage to the valves of the heart. So that is called as valvular heart disease. And the most commonest disease of the heart is the disease which actually relate to the arteries of the heart, those arteries which actually supply to the heart. So this is called as a coronary heart disease, and we more focus on the coronary heart disease. The coronary artery disease, which is the disease which can be prevented, and the prevention can be really achieved by person or by the medication, and then the disease is really treatable. Rest of the also diseases are also treatable, but they are treatable in by various way, by the surgical ways or by the medications. So these are the broadly we can see about the diseases of the heart. We more focus in our practice is the disease which is actually related with the coronary arteries, that is called as ischemic heart disease, or we can call it is like CAD. This is in a simple way, but this is the most commonest thing what we come across the city.
So all these diseases or various forms of heart diseases which you have named, so all are basically cured through a surgery or probably a bypass. Which of these diseases requires a bypass for sure?
Okay. Those disease which actually related to the coronary artery, that is require all that bypass surgery. Bypass is mean that there is a way where there is a block is there, then there is a way of putting a new vein or artery grafting beyond the graft. So that's called as a bypass surgery. Now this is a coronary artery bypass surgery. So this is what is in the only in coronary artery disease. So what we see in a coronary artery disease, the artery which is getting blocked by atherosclerosis process which occur inside the artery, and the artery gets a block, or if the blood becomes very clotting mechanism is too much disturbed, the blood becomes too thick, and then it forms embolus, and then it blocks the artery. So this is also two reasons to get the blockage in the artery. So one is atherosclerosis and another is the embolus formation. An embolus formation which occurs in mostly in a young population, but atherosclerosis takes place in older population. That older populations beyond 50 years, beyond 40 years, these things can happen.
So today, in this world where people are so busy and in their hustle life, actually, we do not even know that we have a heart disease. So basically, how does a person? What are the symptoms through which a person can know that he is, getting into it, and how can that be a first, cure or maybe a first advice for a doctor?
Okay. So anybody, we talk in a different way. All congenital heart disease may not produce the symptoms unless they are very grave disease. They may not come to, people may not come to understand the disease, the heart disease in early life. So the child who is going to school, they've been already screened by the government for the echocardiography, and people can come to understand the congenital heart disease at this age. The next part is the rheumatic fever induced valvular heart disease. That also you may not get the symptoms unless the disease is very much pronounced or very much the wall gets very much constricted, and then it can produce a symptom, and that symptom is a breathlessness, and like you feel like breathless while walking, or you feel like dyspneic while climbing the staircase. This is unusual phenomena which people may sometimes get it, and it is very difficult to understand by the person. So you may definitely, somebody who has got such a kind of disease, such kind of symptom, they can definitely get screened for heart in the form of doing echocardiography once a while whenever there is such a kind of symptoms arises. Then next is because the coronary artery disease, in that case you tends to get chest pain, which is very commonest symptom in coronary artery disease. But then not all patients can get a chest pain, but there are at least 30-40% of the people, they may not get the chest pain. That is called as a silent coronary artery disease, or it is called as a silent ischemia, or people can get a heart attack which may be sometimes unnoticed. That is also called an silent heart attack.
Sorry to interrupt, sir, but this, you get a heart attack, maybe you get a heart trouble, or something like, pain in the heart. Is this a continuous form, or it comes and goes? What is form that
90% the people, once they start getting the chest pain, and if the pain comes in a pricking manner, it may not be related with the heart disease. And the pain which arises exactly after exercise, and pain which increases after the exercise, and the pain which increases by climbing the staircase, pain which increases because of the stress also, or maybe some psychological pressure, that can be definitely maybe a possibility of having a coronary artery disease. And in that case, patient should get immediately checked with the ECG, or they may go ahead with the treadmill test, where they can come to understand the exactly cause of that pain.
Well, now that we know the symptoms of this disease, we'd like to know what has been the major causes for the disease.
Before we forget, the symptoms of coronary artery disease does not vary with a gender. A patient may be a female or male, the symptoms may be same. But in a female, there are the symptoms which very classically pronounced, like chest pain. You may not get in the females. They may get some kind of fatigability, or just a pain in the epigastric region, or just heaviness in the chest, on the backside, or in the throat, or in the neck. These all symptoms can come into females, and they may really require some kind of investigation, and they should go to the hospital or doctor to get ECG done to find out the disease. Now, what are the main causes of the disease which can leads to coronary artery disease? The most commonest cause of the coronary artery disease all over the world is tobacco. Now, this tobacco is entirely related either in the form of chewing, or in the form of smoking, or even that people use for nostrils also. They can use for, some people use for brushing the teeth also. So these all tobacco forms should be, these are the main important reasons to get the heart disease. How this tobacco is acting on your body is the nicotine which contained into the tobacco. It produces or aggravates the atherosclerosis process. It means that it start aggravating the damage inside the arteries, and it leads to more formation of the atherosclerosis. It means the accumulation of the fat in the vessel, and it causes a block in the artery. Another thing is that if you smoke a cigarette, it contains large quantity of carbon dioxide, which replaces the oxygen, and thereby the heart has to perform more time in a minute. So the heart is under stress during the smoking period. So that is also to be a very important reason to get the atherosclerosis in the artery. The next important reason to get the atherosclerosis is diabetes. The person who is a diabetic person who has sugars which were very uncontrolled, and the sugars which are in uncontrolled sugars having more glucose, this is get converted into ultimately fats, and these fats gets deposited into damaged arteries and it forms a block. The next very important thing which we come across is hypertension, where people don't get any kind of symptom unless the particular organ has got a damage. So the hypertension is also very important part of development of the heart disease. Then the next, there is another very important factor in our society is the lifestyle, where the people having a very sedentary lifestyle. We can say the patient they don't move around, they sit at one place, they don't do exercise. These kind of people also get very there they get a high chances of the coronary artery disease. Another very important factor is the obesity. The patient who has got obese, he has got all the chances to develop hypertension, diabetes, and ultimately the heart disease. So these are the main basic reasons for the heart disease. Then what are other diseases? What are the other causes besides this? Is the stress, which people comes to understand. Every now and then, the metropolis person has under stress for making money and all, so many things. But the stress is entirely related with your environment or your job profile, and that also can leads to heart disease by increasing your blood pressure, by increasing your cholesterol in the body, by increasing, if there is a diabetic, then it increases your sugars. And besides this, what we can understand is what is the level of cholesterol of in the body. What is the cholesterol? Like the bad cholesterol in the form of LDL, VLDL, and triglyceride. They are bad cholesterol in the body. If they also rises, then you tends to develop coronary artery disease. And the most important reason to increase cholesterol in the body is a diet. The diet which comes in the form of mainly in the form of fat, the fat which is like saturated fats, mainly the saturated fat which comes from meat, animal meat, or coconut oil, or palm oil, or bakery products, all that the diet which contains more saturated fats can lead to heart disease. The which kind of fat you can eat is the fats which contains good polyunsaturated fats and monosaturated fats. So these are the contained into your this curdy oil or sulfurose or olive oil. This contains a large quantity of poly and monounsaturated fats, which also in the fish, which also contains this all these good fats which are available in the diet. So this is basically grossly we can say the causes for coronary artery disease.
Well, it's very well understood the causes that doctor has said for the heart diseases. We'd also like to know something about the preventions or the treatments that we can be done for these diseases.
Okay. So anybody who is suffering with certainly with congenital heart disease, we talked about congenital heart disease where the people have got there is a hole in the septum, or it can be treated by surgical ways, or there are various ways by putting some kind of you can say there is a device we can put into that septum and we can close that abnormality in congenital heart disease. Similarly, in the wall cases, we can open the wall with the balloons and keep the wall open, and thereafter if the wall is very calcified or thick, then of course we can go for a replacement of the wall. Then the next procedure which comes for the heart disease, which is related with the coronary artery disease, where the treatment modality is varies with the disease process, and it varies with the symptoms. So if the person has got immediate heart attack, or patient comes for the with acute chest pain to the hospital, diagnosed to have a heart attack, he can either go for primary angioplasty, or he can go for immediate thrombolysis or dissolving the clot at that place, and thereafter angiography and angioplasty, whatever suitable at that point of time. Of course, if you have a single block, we can definitely think of angioplasty. And please, you have to reach to the center, nearest center, very fast to get rid of this particular blockage as soon as as the time goes, the heart damage increases, and you may get all right with the disease, but the heart damage increases very much, and the heart functioning capacity can drop down from yours 80 to 60% to even 50, 25% to 30%, which is not good, and the life is ill sustained thereafter. So very important is to reach to the hospital very fast and get rid of the blockage very early. That's one thing. If you have a multiple blockage, then there is an option. You can go for multiple angioplasties, or you can say the multivessel PCI, or you can go for a bypass surgery. So these are the basic important treatment modality available at the moment. This is the corrective treatment modality. Of course, you can have choice of taking medicines if the disease is less, and it can prevent the further progression of the disease by controlling your cholesterol, controlling the blood pressure, controlling your diabetes, and of course certainly you need to take some medicine for your heart. These are sometimes nitrates, these medicines which you can take during the treatment modality.
Uh, Very important factor which doctor has just disclosed about the causes. Now let us know all about the prevention methods that can be taken.
Okay, grossly, we would really like to tell people at large that the most important factor in the prevention of the heart disease is you need to do exercise at least for 30-40 minutes in a day, and then you have to take out at least a time to do at least 30-minute exercise in a day. That's very important. Maybe 5 days in a week, but you need to do that minimum 30 minutes of exercise in a day. That's very important. The next important factor to prevent is to avoid a diet which you feel yourself that this is a bad for you. You stop doing that, and there is everybody understands at least in metros what is good diet and what is a bad diet, but you need to stick to the rule of yours that you should not eat what you feel like that's a bad. So avoiding all kinds of oily food, fried food, or fast food which contains a large quantity of butter and all in cream, you should definitely avoid, which contains a large quantity of saturated fats. Even there is no harm in taking some amount of chicken, mutton, but then you must have prepare that in the form of a roasted thing rather than to fry it with oil and all. So maybe you can take fish very large quantity, but avoid prawns which contains large quantity of saturated fats. So this is a very important thing. And another very important, not everyone can afford, is a diet which contains a large quantity of vegetables and fruits, all kinds of fruits, all color fruits which contains a good amount of antioxidants which prevents the blockage of the arteries. So this is what you can have in a diet. Then third important, very important thing is control your blood pressure, and control up to 130, 120. Control, don't bring the pressure even below 100 or 120, because again that is also very bad. If the now this is a recent advance, if the coronaries, if the blood pressure drops very low, the coronary filling also doesn't take place, and then the heart disease can maybe people can get a heart disease. That's what a recent advance said. The control of the diabetes very meticulously is very important. Those obese patients are diabetic, they can definitely go for anti-diabetic, oral anti-diabetics, but the diabetic, those are thin built, they should go for insulin, and which will control the diabetes very well. So, and very importantly, the stress busters, what you can say, if you are Muslim, you go for 5-time namaz. If you are Christian, go for church every week. And if you are Hindus, every day you must go for at least puja. So these are some of the meditations which you can do it, and it's a very easy way to go for meditation. Besides that, you can do all kinds of yogas, whatever you feel it, but exercise is very important, and which will really prevent the coronary artery disease. And above all, most important, the smoking and tobacco. If you stop today, there is at least 30-40% the risk which you tends to get because of the heart disease that can get lowered by 30 to 40%.
Well, sir, talking about Navi Mumbai as such, which is a mega city today, and you right at the heart of the city, which is the Palm Beach area. There are lot many competitive hospitals across, like it's a competitive world today. And Shushrusha being into this profession past 20 years, how do you face this, mode of competition?
Yeah. I'm very straight and really tell you this. There is, as such, for me, there is no competition. As long as I work very hard and I'm being present here for each and every minute for the patient, and I've been having all kinds of modern equipment which can tackle all kinds of emergencies at this particular time. Of course, I may not be able to provide all the five-star facilities what people sometimes require, but that in the form of treatment modality, there is nothing less than what other corporate hospitals are having. Besides this, I am directly approachable for the patient, so that patient can have a discussion for the treatment modality and management and everything. And we very interesting and very important point I would like to stress to these people, that the cost is very important part which people may some people really rich, they can really afford the corporate hospitals, but then there are 60% of people, those who really cannot afford corporate sector hospitals, they can avail the facility of mine, or they can avail the facilities like any other hospital which are medium size. But those people are rich, they also come in an emergency. We have got many patients treated here since 2002 onwards, and we already done more than 4,000 cardiac surgeries here and more than 15,000 coronary invasive procedures here, and around more than 3,000 angioplasties we did here. We have very maybe a one, not even 1%, 0.5% complication rate, and then there is very already 1 or 2%, not 1%, or 0.5% complications or death rate in coronary artery bypass surgeries. So we have very competitive data of very successful surgeries in New Bombay, and this data is available with us, and we are not less than any other corporates in New Bombay.
Well, sir, we'd also like to know about the facilities on the treatment modes of the hospital.
All right. See, for the cardiac patients, we have got from the baseline regular ECGs. Then we have got treadmills. We have 2-3 treadmill test machines, like for the chest test. Then we have echo Doppler machines. We have at least 4-5 echo Doppler machines. So they are continuously available at any time in the 24 hours in a day. Then we have very good angiography machine, which is we can perform angiography at any time in the day, in the night, or even angioplasties we can perform in the night also. Then we have a cardiac theater where all kinds of surgeries, wall replacement, congenital heart disease, bypass surgeries, or peripheral vascular disease surgeries that can be performed in a theater after stopping the heart, without stopping the heart, the beating heart surgeries, or open heart surgeries can be done in a cardiac theater. Then we have a great intensive care unit where good intensivists are available continuously. Beside that, we have all facilities in the intensive care unit, and then associated facilities like pathology laboratory for arterial blood glasses, and for radiology section we have X-ray machines, portable X-ray machine, then we CT scanner, then we have MRI which we can whenever there is such a kind of requirement is required. Besides that, we more or less sometimes we require acuity or dialysis of the patient. So we do have a portable dialysis which can be performed at the bedsides in the intensive care unit, and we have so many other factors which can be catered in any other big good hospital.
Well, we have spoken about a mega city like Navi Mumbai. We'd also like to know that Shushrusha Hospital, whether it provides some kind of a charity services to rural and the remote areas.
Of course, we really proud to say that we've been conducting all the camps for the rural areas in peripheral in Raigad district, and this year in Jawar, and then Murbad and beyond Karjat, and we are bringing the patient those who are really sick, and then we are actually treating there in the free of cost. Of course, in certain cases we are taking help of some government scheme like Rajiv Gandhi Yojana. Then we are also providing very good services for ESIC. So thereby all these poor category patients coming from worker class patient, they are directly come here for any kind of problems, and it will be done in free of cost. That's number one. Number two is we also provide some charity services to the childrens, those who are coming for cardiac surgeries, and we do take sometimes help from the government of Maharashtra and so many other organizations.
Doctor, we'd like to know that today we are here and chatting with the most prominent doctor of Navi Mumbai, the most prominent cardiologist of Navi Mumbai. What is your basic message for the people?
So I would just like to have say only few words. For the children, they should stop all junk foods what they are eating, and they try to play on the grounds. Then morely the ground play like football and volleyball and so many other plays. So that the indoor games they can also play, but then outdoor games are very much important for the children. Of course, for those in between 30 to 40 and 50, the stop smoking is very important, and of course 30 minutes of exercise is very important. Of course, beyond 50, of course, the exercise is very essential part. And then control of the diabetes, hypertension, if you have got that, then that is very important. And the most important thing is that the symptoms which you feel, which are not present or they have not been experienced by you in your entire life, please do consider. The first important thing is ECG. And if the doctor says that if you remain or you need to be observed in the ICU, please do take care. You take that certain kind of thing, maybe sometimes warning sign. 90% there is nothing goes wrong, but 10% you may get into trouble going home with the kind of disease, and then people come here with the very critical diseases. So sometimes believe a doctor at that particular time is also very important.
A very lovely and a very important message by doctor. I hope more and more viewers are watching this and are going by his words. Thank you very much, sir, for giving us your valuable time.
Thank you very much. Thanks.